Hi, everyone. I'm Sarah Schoenig here with Patterson, and we have Dr. Klim out in Santa Rosa, California, joining us today. And Doctor, thank you for joining us.
Good to be with you.
Yeah, and today we are going to talk about CAD/CAM technology, and we're going to do a little Q&A and kind of talk to Dr. Klim about, why he invested in CAD/CAM and really how it helped his practice grow. And so I'll just throw it over to you to kind of tell us a little bit about your history and how long you've been practicing dentistry.
Wow, then I got to talk about my age. Well, it's fine. I got started when I was really young. I was 25 when I got out of dental school. So I'm going on 38 years of practice now.
Congratulations.
And when I was 27, I met my first Patterson rep, and he came in with brand muffins, and he won my heart. And so I've been a client of Patterson for years. So part of my integration through my dental history and where I've gone has been with Patterson. And that's really been a good relationship because I consider my Patterson relationship more like a professional coach. And even with my Patterson rep now, I always ask him about the latest materials. He knows what I want. He screens things for me. So that's how my journey in CAD/CAM started. This technology has been an intricate part of my passion, who I am as a professional, what it does with my fulfillment as a professional. And I'm at 38 years. Can I go another 20? Because when you're in your passion and you find the craft, I always have enjoyed the craft of dentistry, and I enjoyed gold foil, right? I was back in school and we did gold foil and we did a lot of gold. And so the craft of dentistry has always been an interest of mine. And I love people too, don't get me wrong.
Mm-hmm.
But the CAD/CAM and the digital platform gives me control. And so when I reflect on my journey and how I've evolved, I did an interview on Zoom this morning with a group back east. And what I shared, I said, it's actually a culture. So digital dentistry is a culture that transforms the whole office, and you think different about your profession. And when you think differently about your profession and how it impacts you as a person and builds that confidence, it's just a clinical flow and an office culture that is unbelievable. And that's my passion. My passion is to get that message out there and say, you can all have this and experience things in your profession that maybe you didn't know was possible.
Yeah. Well, that's really cool. And you talked a little bit about why you invested in it, what it's done to your practice, and really how it's kind of changed your career. Obviously, we've heard this saying over the past couple of months, we're living in crazy times right now with the pandemic and COVID. What do you think with CAD/CAM, what's the opportunity to invest in it right now, kind of during this time?
I'm going to step back for a moment because I was asked this question this morning and several times. Is it's expensive. I go, no, it's free. And what do I mean by that?
Yeah.
Well, if I reflect over 10 years, okay, and I adopted the technology. So over 10 years, it saved me in overhead 1.3 million. And sure, in that period of time, I probably invested maybe 350,000, and then products, maybe another 100,000 in products. So it didn't really cost me anything. But yet there's a big price tag on it. But it is probably the one thing in my career that didn't cost me anything. You pay for a chair, you pay for it, you pay for a new office. I've had 2 new offices in my career, and it's part of doing business. But the net return, and I didn't get it for the money saving. I got it for control. I got it because I enjoyed the craft of dentistry. And what I tell people this is that it's a huge price tag, but yet it's really not. The money is here because unless one can experience what it does for an office, there's tangible rate of returns and there's intangible rate of returns because it changes one as a person. Part of success is having passion and discipline to be the best we can be. And that is called momentum, right? So there's momentum factors that happen. I've done enough training with CEREC, and that's what I do part-time, actually half-time. I'm an educator with CAD CAM, and I've seen offices virtually transform in a period of just a year. Now with the current system, it was a little longer than that when I got into it, where the whole operations of the office changes. It creates momentum. So what it does for you is there's hard and soft results with this. The hard result is, what I mean by that is that it costs money, and yet it lowers your overhead, and yet it helps momentum, and yet it transforms the office. I mean, how could you not do it? And particularly now coming back from a shutdown, that emotion is really strong. And yet on the other hand, now's the better time, because my patients, in fact, I've learned this, my patients love the one appointment. I mean, I always knew they did, but now they actually verbalize, I'm glad I only can be here once. And I like it because that means I don't have to have as many patients in the chair during the day. That means less patient flow, which is really important, because how can you have less patient flow and still keep your production up? And that's the perfect time right now, because it's protecting our patients. We screen our patients. We don't have as many patients in the office. Even now, we don't have one patient interact in the same room with another patient. So when they're coming in and they're coming out, they're only seeing 2 people, and that's it. Well, this technology and the way we flow it clinically fits perfectly into that and still allows you to be very productive.
So, I was thinking a little bit about Dentsply Sirona World. I was there last year, and I was doing. I know it's going to be virtual this year.
Yeah.
Like everything, but there's different customers that come in and out of the booth, and a lot of them that we talked to were kind of on the fence about this was a year ago, but about investing in a CAD CAM. And I know you kind of touched on this, but what advice do you have for them, for these people who are on the fence and haven't pulled the plug yet?
Paul Homley shared a phrase with me a while back, and it's always had a good impact on me. And that is, when you're chairside with a client, it's no different than my relationship with my patients. Number one is I want to create an environment that's safe and secure. Number two, I listen to what my patients' objectives are. I always call my patients clients, right? What are your objectives? And tell me how you want the relationship to go, because my job is to be candid with compassion, right? And when I have that relationship with people, then we have a time of where when it's right for them, maybe they'll choose this. I mean, I had a lady come in this week, and she's been a patient for 10 years, and she says, I'm finally ready for my veneers. Well, she didn't feel pressured, and maybe it took her 10 years. And the reason why she's starting a new business of where she's going to be in front of cameras and social media, and now she is more sensitive to that. I would say that's the same for people when they're looking at this technology. There's always going to be a time when it's right for you. And I think a lot of it is understanding what it can do for you. Is there a tangible path that you can make it happen for you? Because as an educator and opinion leader, a lot of times you can get up there and you're going, well, yeah, they can do it. In fact, I get that all the time. Well, yeah, Dr. Klim, well, you can do it. Well, no, I'm stubborn on that. No, you can do it too. And it's just a matter of having mental fortitude and having a desire to get your end result. So I always tell people, do future focus. Bill Blatchford has helped me a lot in my career, where he'd always say, where do you want to be in 3 years? Where do you want to be in 5 years? Where do you want to be in 7 years? And sure, there's going to be hiccups and circumstances in life that may change that journey. But when you look future focused, you start thinking bigger picture, and that helps us to make decisions. So what I have found is most doctors have to be to a point of where they have to be convinced that the technology works, right? Number two, they have to be able to imagine that it's going to work for them. Where we had to really work on that 10 years ago, whereas today, no, it pretty much flows. And then they have to be convinced it's going to be worth their time and investment. And I think as professionals, and I consider my part well, let me put it this way. I consider myself to be part of the Patterson team in this sense of where they're the company that I've worked closely with, is that there's education, there's timing, and then there's the right time. And I think it's the continual relationship that we all have with our other colleagues in the profession, and which includes my Patterson reps as well, when the time is right. And I think most people get over that hurdle when they can imagine themselves doing it themselves. And we're at a really sweet spot. I always say we're at a sweet spot now because the technology is easy to use. It's fairly error-free with scanning, because in the old days we had to scan a certain way with so many images, or it would distort and it wouldn't fit, and then that creates stress. So I think getting into this technology is you can have precision, you can have turnaround, you have affordability, because as I've mentioned, it's not expensive. And then you can delegate that with your team, and it creates momentum. I think if that's the information people can understand, then they can make a better choice to see if it's going to fit for them.